Childhood health anxiety, the family connection.
Yes, children get health anxiety too, and it often runs in families. A parent's own worry shapes how a child reads every ache. Now, if you're a parent watching this explainer, I really want to validate what you might be going through at home. It's exhausting, it's scary, and it's absolutely a very real phenomenon. Today, we're going to look closely at what the latest research tells us about childhood illness anxiety, how the family dynamic plays a critical role, and what the evidence actually says about breaking the cycle. Section 1. Recognizing childhood health anxiety.
Okay, let's dive right into this. The first step is simply recognizing what we're dealing with. And I want to start by being super clear with a reassuring, evidence-grounded fact. When your kid is gripped by the fear of getting sick, their distress is 100% genuine. They aren't just faking a stomachache to get out of a math test. They are truly experiencing an intense, often overwhelming fear. Let's translate the clinical jargon into the exact behaviors you might actually be seeing in your living room. First up, we have constant body checking. This isn't just a casual, hey, I feel warm. This is your child repeatedly checking their pulse, pressing on their stomach over and over to see if it still hurts, or obsessively examining a totally normal skin blemish. Then there's repeated reassurance-seeking. The endless loop of questions. Mom, do I have a fever? Are you absolutely sure I'm not going to throw up? Do we need to go to the doctor right now? And finally, catastrophizing. This is when the brain's alarm system kind of malfunctions. So a simple, everyday headache is instantly interpreted as a life-threatening brain tumor. The child genuinely misinterprets perfectly normal, benign bodily sensations as signs of a serious illness.
But of course, kids worry, right? That's just part of growing up. So the crucial point here is understanding that health anxiety exists on a continuum. On one side, you have normal childhood worry. A child might hear about a flu going around, feel a little scared, ask you a question, and be easily reassured by a hug and an explanation. On the other side, we have pathological impairment. This is where the fear becomes persistent, the distress doesn't fade with reassurance, it actually drives excessive doctor visits, disrupts daily life, and becomes a really heavy burden for the child. And if you're sitting there thinking this is strictly an adult issue, take a look at this number, 11.6. Retrospective research analyzing adults who suffer from severe health anxiety found that their mean symptom onset age was just 11.6 years old. Think about that. That means these profound illness worries are emerging super early, often right at the transition into pre-adolescence, and they can absolutely set the stage for a lifetime of distress if left unaddressed.
Section 2. The family connection. Let's see how this all built, because this is where the puzzle pieces really come together. We need to talk about why this happens and why the family dynamic is absolutely central to the development of this anxiety. The research points to a very specific concept called health anxiety by proxy. I want to frame this carefully because it almost always originates from the deepest place of parental love and protective instinct. Health anxiety by proxy is when a parent has a persistent, intense concern about their child's health. But that concern inadvertently drives overprotection. It leads the parent to misinterpret the child's mild symptoms as dangerous, and without even realizing it, they begin modeling that fear. And this brilliantly illustrates the exact mechanism of transgenerational transmission. It's basically an echo chamber of worry. Step 1, a child has a normal bodily sensation, maybe a stomach gurgle. The parent, who might be dealing with their own health anxiety, catastrophizes the symptom, showing visible distress or immediately rushing to schedule medical tests. Step 2, the child observes this. Kids are incredibly intuitive. They model this fear, learning that their body is a fragile, dangerous place. Step 3, the reassurance loops kick in. The child seeks comfort. The parent provides temporary comfort but also accommodates the excessive checking, and paradoxically, this actually reinforces and maintains the child's anxiety in the long term. Section 3. Impairment and healthcare impact.
We really have to look at the reality of what happens when this cycle goes unchecked. When childhood health anxiety persists right through adolescence, it carries immense real-world consequences. The tangible impacts are honestly staggering. First, it significantly drives up pediatric primary care visits. We see frequent flyers in doctors' offices running expensive and unnecessary tests that yield no physical diagnosis but do absolutely nothing to stop the anxiety. Second, it triggers cyberchondria. This is the excessive, repeated browsing of the internet for health information. Teenagers are highly susceptible to falling down that WebMD rabbit hole, which only pours gasoline on their fear. Third, it leads to severe school absenteeism. And finally, the research shows high comorbidity. Health anxiety rarely travels alone. It heavily overlaps with obsessive-compulsive disorder, generalized anxiety, and functional somatic symptoms like chronic abdominal pain.
Section 4. Treating the anxiety loop.
So we know what it looks like, we know where it comes from, and we know exactly how damaging it can be. Let's pivot to solutions and how we treat the anxiety loop. I want to be refreshingly transparent with you about what the scientific evidence actually says regarding pediatric interventions.
The 2024 seminal annual research review by Dr. Rask and colleagues explicitly flags a significant gap in the literature. Youth-specific randomized controlled trials for health anxiety are largely lacking. I will never fabricate a youth-specific efficacy statistic just to sound reassuring. The truth is, the specific clinical research on kids for this precise diagnosis is still in its infancy.
Because of that gap, the current best practice treatment is adapted straight from adult cognitive behavioral therapy, or CBT, and it heavily involves the family. The practical approach focuses on 3 core steps. First, you absolutely must reduce the checking and the reassurance loops. This means gradually stopping the constant temperature checks and the endless "am I okay" conversations. Second, normalizing benign bodily sensations, teaching the child that a stomach ache is usually just a stomach ache, not a crisis. And third, and most importantly, working on the family's illness beliefs. The entire family has to learn to tolerate uncertainty because demanding 100% certainty about health is exactly what feeds the anxiety.
But there is incredibly promising news on the horizon. Researchers recognize that treating the parent's health anxiety by proxy directly helps the child. Scalable approaches, like internet-delivered CBT programs designed specifically to target these parental factors, are showing great benefit in treating related pediatric somatic conditions. By giving parents the tools to manage their own health anxiety, we cut off that transgenerational transmission right at the source.
Section 5. Seeking professional help.
This brings us to a really critical junction. What you should do next if you recognize your family in this explainer. Because childhood health anxiety overlaps heavily with other clinical disorders like OCD and generalized anxiety, a persistent, impairing fear of getting sick absolutely warrants a professional assessment. Please consult a qualified healthcare provider or a pediatric psychologist. This explainer is here to empower you with knowledge, but it obviously cannot diagnose your child. Getting a professional in your corner is by far the best way to start adapting those CBT principles for your specific family dynamic. As we wrap up our analysis of this incredibly important topic, I want to leave you with a thought to reflect on today. You have profound power within your family system. So ask yourself, how might shifting your own reaction to a simple ache break the cycle of fear for your child?
Fear Me Not helps kids conquer fears through play.